Welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books. Our mission here at Health Authority TV is to bring together a community of health business experts and find out what's happening in their world and also look to the future possibilities. Our guest this week is Dr. John O'Brien, author of Rudeness Rehab. Welcome, John.
Thanks so much, Devin. Thanks so much for having me.
Yeah, it's so nice to see you. And just to kick us off, why don't you tell us who you serve as a health authority?
My business is Activate Success, based in Portland, Maine, and I work with leaders in a variety of business areas, but with specific emphasis on financial services and healthcare and technology. I provide coaching and consultation to leaders, and I also do professional speaking on topics related to stress management, balanced living, and now my niche, which is the impact, a negative impact of rudeness and incivility.
Nice. And so then what services do you provide to those groups?
So for those groups, as I said, I provide executive coaching, leadership development, consultation about difficult issues that businesses are facing, including the management of difficult behaviors in the workplace, sometimes disruptive behaviors, sometimes on the part of leaders in the organization. And I also do provide professional speaking to associations as well as to specific businesses that are wanting training or education for their staff.
Yeah, I mean, I know we worked together on your book, Rudeness Rehab, and there are some, doozies of some stories, situations people have gotten into. Do you maybe have one example of this kind of coaching you can provide to, a maybe not so positive workplace situation?
Yes, so I think of a leader that I started to see during the pandemic, a leader of a small business. And um, he was wanting to support in navigating some of the challenges that you face, that we all faced in trying to keep our businesses afloat in the pandemic. He said he also wanted support in being a better leader. And one time we were meeting and I offered him my feedback about what I thought was kind of effective in the situation. And he rolled his eyes and scoffed at me and said, that's not it at all, John, and went to move on. And I stopped him and I said, hold on, what just happened? And he didn't understand. And I focused him on the fact that he had rolled his eyes and kind of just dismissed me, and that didn't feel good. And sort of I wondered if that was coming up in other places in his life. Suffice to say, he was not exactly thrilled with me in that meeting. Got somewhat defensive, but was able to integrate that afterwards and came back the next week. And that led to, I think, a real change in his behavior at work and being more aware of how he was coming across to his employees. But interestingly enough, when he talked to his wife about it, he also realized that maybe that was something that was happening at home. And so it really brought his attention to the impact sometimes of nonverbal behavior we may not be aware of.
Yeah. Yeah, I think you have lots of really great stories like that in your book. And I think most people can agree we have seen a lessening of civility just in general in the world. So we could all use those tips. So we'll make sure we have a link to your book in the show notes for the listeners to check out. Um,
Right.
but now we want to move on to this conversation that we are engaging the community with. And so, based on your experience as a health authority, how do you think we can redesign America's healthcare system?
Well, that's a mouthful.
That's a softball question for you, John.
Just yes, just an easy question to solve in 10 words or less. Well, I will also say that, my background as a psychologist, I've also provided individual psychotherapy to people for almost 30 years. So I also have that background in being a healthcare provider directly and working with insurance. I think my belief is that everybody should have some form of insurance. I think that the system suffers when there are people who don't have insurance and then therefore are costing the system more by going to the emergency room or other places. So I am very interested in the model that the Germans have, which is it's kind of a two-tiered system. Everybody has basic insurance that is paid for in part, I believe, by individuals, but also corporations are contributing. Every business contributes some to this pool of basic insurance that everybody has. And then some larger businesses or businesses that wish to then contribute to people having additional coverage. So I realize it means that there is still a difference in terms of coverage, but I'm a firm believer that everybody should have some form of coverage. So that's one thing that I really think. Um, I also I have very good friends in the insurance industry, and so I'm a supportive of their work. But I um, am also a believer that if you have a healthcare organization that's supposed to be providing the best care that they can for individuals, but within a for-profit model, I think those two things clash, and I think it's just setting the system up to make it such that people, healthcare businesses and insurance companies choose between greater profits or supporting their members with better benefits. And I understand that's a difficult balance to strike, but in that way, I think I'm just a firm believer that I don't think that we should have a healthcare system that's based on a for-profit model because it automatically sets up that difference. Um, And I think the argument I've heard that some people are already thinking right now as I'm saying this is that if we have a nonprofit system, well, we are going to be doing away with some of the revolutionary technologies that we see that come from the innovation and investment that won't be rewarded as much in the not nonprofit model. So that is a sticking point, but I still believe that there would be ways through investment and other things that people could still benefit from revolutionizing healthcare while still having something that's not for profit. The last thing I would say is, and I'll let you react, but the last thing I'll say is having been a provider and still a provider of healthcare services myself and interacting a lot with other healthcare providers, specifically primary care. I think our health insurance models are placing so much burden on healthcare, excuse me, on primary care offices and primary care providers. They don't have enough resources to be able to meet all of the measures and quality measures that they're supposed to be meeting. And they don't have enough staff that to be able to do all those things. So I think investing in more support for primary care physicians and primary care providers if they are going to be the backbone of our healthcare system, I think then they need to have more support.
Thanks. Yeah, I think it's very interesting to look at other countries' solutions as well, because everybody is dealing with health. So what can we all learn from each other? Um, I'm kind of curious to look into Germany's solution a little bit more because that does sound like a maybe a good middle ground. Um,
Yes.
because I know
Yeah.
obviously, we get a lot of resistance to the universal healthcare plans. So maybe there is something kind of in between. And I guess I would also be curious to know, like, is that stopping those countries from doing technological advances? Is that
Yeah.
really, you know, is that really an outcome that happens if you take away some of the for-profit pieces to it? Um, so those are interesting things to ponder, and
Yeah,
one
I would just
one
say
we
that
haven't heard yet. So
I would just say that I think in Germany is well known for many healthcare advances. So I
yeah,
don't think that that model is stopping them. I don't think it's perfect. I mean, no model is perfect, but I
right.
think I've heard some people say that, and I've read this recently, that if numerous people lose their health insurance, lose Medicaid, it's going to be better for the system.
Hmm.
And I guess the argument, I don't know, somehow the argument is going to be better for the system because not as many people will be able to go to offices, and so then more space will be opened up. But that doesn't feel like it's better for the system. And I think
Right.
even whether people are uninsured or when they're underinsured, they don't get the care that they need. And then they end up sort of showing up in emergency rooms or at hospitals, and their illnesses are further advanced and they end up costing the system more. So, and I think also, a focus on wellness too. Germany also has a great focus on wellness where physicians can actually write for people to go to a wellness retreat for a few weeks, for example, for stress, and that's actually covered by health insurance. So,
Interesting. Wow.
yeah,
Yeah, I think, getting ahead of a lot of these um, issues and prevents then the emergency cases. If we can
yes,
really start treating people earlier, and then that benefits us all because you don't want the emergency rooms clogged for the true emergencies. So,
yes,
well, thank you so much for sharing your thoughts and insights. And for our listeners, this is a conversation we want everyone to get involved with. So we'd love to hear your thoughts in the comments. And we will be back next week with another guest. And until then, may you be healthy, wealthy, and wise.